So now, to help out understand a little bit, Dr. Skander, about getting ready for surgery, getting the patient ready for surgery, the anesthesia piece of this. I've gotten to see you have multiple ways you can sedate a patient to go through this. So walk me through how you make a decision on what a patient needs from a comfort level, or do you always do IV sedation now? Or walk me through that, because not everybody does.
When you have such kind of procedures, this extensive one, extractions, grafting, things, implant, you really need actually the patient to stay still, calm, relax, stable, so you can perform your work, right? Believe it or not, the quality of the work the clinician can do is highly dependent of how the patient is cooperative and still on the chair.
Yeah.
So if I'm working with a patient and he's in pain or is uncomfortable, I will be distracting my focus of the procedure between doing the procedure and taking care of the patient's calm and no pain. Okay, but that's not right. It affects the quality on the accuracy. Like, let's say that I want to do something, I might have to rush it or something so I can pass this point through. This procedure here, we have no really room of errors. Really. Yeah. It has to be done right and precise. You are dealing with the entire mouth here. Yeah. If you are watching a movie, interesting movie for 2-3 hours, you might get bored. Imagine you are sitting on the chair without sedation, opening your mouth and having all this around you. No fun.
Yeah.
Patient need to be like fully sedated.
Okay.
In this particular procedure. It's lengthy, long. You need also your time to focus, your way to focus.
Yeah. So you guys bring in an actual dental anesthesiologist. It was Dr. Zia in this case, which I had met several times before.
A lot of the patient doesn't know that one of the specialties of dentistry is dental anesthesiology. Not just like orthodontist, periodontist, or no, another one actually even accredited by the ADA to be dental anesthesiologist. It's for this, for dental procedures.
There's not that many out there.
Not really.
Okay, so which gave me a high degree of comfort, because you're talking about having the patient sedated, and that can go wrong if not handled rightly. You know, I mean, you want to make sure that process of how you're putting them under, that they're well monitored and that.
When you say you, not me, right? You can be good in everything.
Right.
Right. So you need every piece of this one to be given to the specialist who can handle it well and have long experience doing it. Okay. Yes, I have do some experience in sedation, fine. But do I really need to focus on the patient monitors or the patient mouth?
Yeah.
I believe I need to patient mouth, right?
Yeah.
So I have to have like anesthesiologist with me,
right?
Specialist.
Right.
All what he's doing in the room actually is taking care of the patient, looking at the monitors, communicating with me if anything I need to be aware of, and so forth.
Yeah.
This is what he's doing all day long, every day. Checking patient health, medical history, what he needs to do, this, that, what kind of level of sedation he can go, his general health.
Yeah.
It can tolerate or no. Sometimes, you know what? This is not an office setup. This patient is medically compromised to the extent this surgery needs to be done in a hospital. It happens.
Yeah, that's a great point.
Taking care of the patient's health is as important as, the mouth.
Yes.
Sometimes you have a very easy dental procedure, but health doesn't help you here.
Yeah.
You have to be careful on that.
You know, and you talked about it earlier of how the patient being still, your focus, your worry, because it's high intensity. I mean, you're dealing with some intense work being done, that if you're distracted over here because the patient's.
Imagine I'm working with drills with a speed of 1600 RPM. I'm dealing with very small pieces of implants, 10 millimeter, 12 millimeter. You see like how very delicate, precise, small piece you are working with in a patient mouth? And no, it has to be still.
Yeah. And okay, I know you're about ready to get started with the extraction piece, but before we do that, I want to ask one more question about the anesthesia side. I had a lot of fun in college, and some of that was recreational fun that included substances that might or might not have been legal at that time. And so, how important is it for somebody to share if they had a season of partying, if you will, of using illicit substances? So, how important is it for that person to share with the anesthesia?
Very important. I can't stress enough how important it is.
Yeah.
We are your doctors.
Yes.
Right? We are in this closed surgical room together.
Right.
Now we are in charge of doing this procedure for you. You need to share with us everything you had. What kind of medications or drugs or whatever thing that you had in your life, even recently or while ago. That affect what the anesthesiologist will be using to control and to give you the right level of sedation.
Yeah.
Even for me to know what kind of pain medication I will have to give you afterwards.
Yeah.
Some patients, if they already have been in very high doses of hydrocodone or something for a long time, the amount of pain medication I'm be giving normally for patient might not work for them.
Right.
We need to know, nothing to hide.
Yeah.
I mean, you have to share all this information, even if it's very private, confident. We are covering here. There is HIPAA things. This will not be shared with anybody on the planet, but we need to know it.
In my case.
But we need to know it.
Yeah.
Because that control a lot of things. Again, this procedure is not just dental implant plates in bone. If you see steps behind the procedure, numbing you, controlling you, making sure all the monitors, your oxygen level, your heart rate, your blood pressure, all this need to be controlled. How much medication I will give you based of your body tolerance to put you on the right state of comfort.
Comfort, yeah. You know, I wanna take a minute and just really and share with you from a personal side of things. You can feel very embarrassed if you had a season that you might not be a part of now, but there might have been drugs in your history or alcohol in your history or any of those kind of things, and you can feel tempted to not share that information with them. But now I think hopefully you guys see the complexity of what goes into this. It's not just they have one shot and they put that in your rear and now you're sedated. No, it's a custom cocktail. And so to give them the information that they need to properly treat you and not put you in jeopardy. So it's in your best interest to be honest and vulnerable with the doctor. Like he said, there's HIPAA regulations. He's not going to go text it out on Facebook or anything like that. But I do know the fear of that. And I even with Dr. Zia, I wanted to dance around the subject some, and that's probably why I woke up a little bit, from my history. So again, part of what I want to share with you guys is what I've done well and what I've learned also in the process. So I want to encourage you guys on that. Okay, I appreciate you sharing that.
One more to think, like sometimes, usually this procedure is done under level 3 or 4 IV sedation, okay?
Right.
This is what we call it. Some cases with some history of drugs or so, we need to put the patient on general anesthesia, not just IV sedation. So patient sharing with us this history is very important also for us to determine IV sedation is enough or no. Sometimes it happened a couple of times with us or a few times. We started the IV sedation, it didn't work. Not just didn't work, the patient started to act differently,
Really?
like very aggressive.
Really?
That's why we have to quit, stop, abort the surgery, and we have to reschedule the patient for a general anesthesia setup. Different story. The reason why patient didn't share with us some very important medical or history that he has.
Okay.
So it doesn't harm you just to tell us from the beginning. This is what I have. That's what I have been through. Just be prepared. Fine.
Side note to the other clinicians out there, help make this a comfortable environment for patients to feel. I mean, I was blessed because I had a relationship, long relationship with Dr. Iskander and even Dr. Ratana and Dr. Zia, and so I was in a very unique position. But I know what it's like to be a patient and be scared of being judged and feel shame from the clinician. You know, some dentists out there try to use that as a tactic to sell. Please don't, in this position, let that patient know that it's a safe place to be honest, open, and that you're on their side to help make this a success. That's why I felt comfortable in doing this, but I can see why some might not be. So clinicians out there, please take note of this.